Holidays are a time for family, food, and celebration, but for many, they're also a time for unexpected trips to the ER. Hey everyone, Dr. Jordan Wagner here, board-certified emergency medicine physician and co-founder of Life Happens. Today, we're breaking down the top holiday injuries and medical issues I see every year like clockwork. All right, let's dive in. Number 1, the holiday heart attacks. You may hear the phrase holiday heart attack and think, oh, that's definitely induced by things like family and shopping stress. The reality is more chilling. Most heart attacks this winter season that I treat usually come from shoveling snow. The combination of cold weather and physical exertion can seriously strain your heart, especially if you have an underlying condition. Shoveling snow causes a sudden spike in blood pressure, increasing the risk of your heart attack. If you're out there clearing your driveway, pace yourself. Stay hydrated and avoid overexertion. If you feel any sort of chest pain, shortness of breath, or dizziness, stop immediately and seek medical attention. In the ER, time is crucial. We treat it usually quickly by performing an EKG and blood tests to check for heart damage. Depending on the severity of the situation, treatment may include oxygen, aspirin, and nitroglycerin to ease chest pain, along with clot-busting medications. Severe cases may require emergency interventions like angioplasty or stenting to restore blood flow. In general, early action can save your heart and your life. Number 2 holiday injury, falls from ladders and roofs. From hanging holiday lights to clearing gutters, ladder injuries spike every holiday season. Common injuries I see are things like fractures, aka broken bones, head trauma, and sprains. Please always have a spotter when climbing and never rush the job, especially if it's icy. Most falls happen when people try to stretch too far or use a ladder on uneven ground. Trust me, a crooked string of lights is better than a crooked face or a broken bone. But let's say worst case scenario that you do fall off a ladder. How would you treat it in the emergency department? Depending on the injury, treatment can range from imaging tests like x-rays or CT scans to assessing fractures or head injuries to then splinting or casting broken bones. Severe fractures may require surgery. For head injuries, we monitor for signs of concussion or brain injury and might even keep you for observation if symptoms are concerning. Ice, elevation, and rest can help with less severe injuries at home, but always seek evaluation for significant pain or swelling. Number 3, holiday cooking burns and cuts. Cooking injuries are another frequent flyer in the ER during the holidays. Burns from hot ovens, stovetops, or boiling liquids are common, as are deep cuts from chopping food in a rush. Believe it or not, dull knives are sometimes more dangerous. Keep your knives sharp and always take your time and pay attention when cutting things like vegetables or meat. Then, when it comes to baking, please use oven mitts when handling hot items or partaking in soup. The amount of times I see bad burns from soup, it may surprise you. Burns are treated based on severity. Minor burns are cleaned and bandaged with antibiotic ointment, while more severe burns may require specialized dressings or even a transfer to a burn center. Deep cuts may need stitches or surgical glue and will ensure your tetanus vaccination is up to date. Pain management and wound care instructions are provided to support healing at home. A little extra caution can go a long way towards preventing these painful mishaps. Have you ever burned yourself cooking or sliced a digit by accident? Let me know in the comments. Number 4, food poisoning. Improperly cooked holiday meals lead to an array of problems, especially foodborne illnesses. Symptoms like nausea, vomiting, and diarrhea can hit fast and hard. Things like turkey and chicken and stuffing are all notorious for bacteria like Salmonella and E. coli if not cooked thoroughly. Use a food thermometer and store leftovers properly to avoid a holiday night spent hugging the toilet. If you do get a little case of food poisoning, for mild cases, we focus on hydration and rest. Severe cases, especially with dehydration, you may require IV fluids and anti-nausea medications. If symptoms persist or we suspect a serious infection like Salmonella or Listeria, we may run stool or blood tests and prescribe antibiotics if needed. Prevention is key, so always follow food safety guidelines and or leave it to your grandmother or the other cooking experts in the family. If it's gray and not gravy, probably skip it. Number 5, alcohol-related injuries and overindulgence. The combination of holiday parties and alcohol can lead to a lot of potential badness, slips, falls, and even car accidents. Alcohol also impairs your judgment and reflexes, increasing the risk of injury in general. While drinking in excess can put a strain on your liver and hydration levels, leading to bad hangovers or worse, alcohol poisoning, if you're indulging in adult beverages this season, please pace yourselves. If you do find yourself celebrating a little too much, check out Portis Decisions from my company Life Happns. This little spirit lifter is designed to help you recover faster and stay hydrated. If you are interested, you can find Poor Decisions at lifehappens.com or on Amazon. Eat before drinking, drink lots of water, and arrange for a designated driver or ride share to get you home safely. It's all about taking the responsible approach. If you were to experience alcohol poisoning and come to the hospital, we focus on monitoring your vital signs, ensuring your airway is clear, and administering IV fluids to prevent dehydration. In the most severe cases, medications for nausea might help, but if you are so sedate, there are times that a doctor might have to intubate you to protect your airway. We will also monitor you for complications like seizures or arrhythmias, but the best approach is prevention and drinking responsibly and knowing your limits. Number 6, frostbite and hypothermia. Frostbite damages the skin and tissues, while hypothermia can affect your entire body, leading to confusion, fatigue, and even death if untreated. Make sure you bundle up, cover exposed skin, and take breaks indoors to stay warm. You do not want to come in having to be treated for this. For frostbite, we rewarm the affected area gradually using warm water baths and treat any blisters or damaged tissue. Severe cases may require debridement or even amputation. Amputation of dead digits, for instance, or whatever has been affected. For hypothermia specifically, we focus on rewarming your core temperature using blankets, IV fluids, and heated oxygen or blood rewarming techniques. Early intervention saves lives, so act quickly if you suspect either condition. Number 7, stress-related issues. The holidays bring plenty of joy, but they also come with stress, overeating, and too much alcohol, too much salt or caffeine, which can lead to irregular heart rhythms or even heart failure. Known as holiday heart syndrome, this atrial fibrillation is somewhat common during this time of year. If you're feeling stressed, make sure you take time to relax, stay hydrated, and keep indulgences in moderation. If you're experiencing anything like palpitations, shortness of breath, dizziness, or chest pain, it's definitely advisable to get to the hospital. For irregular heart rhythms, we may perform an EKG and monitor your vital signs. Medications like beta blockers or antiarrhythmics can potentially stabilize your heart rhythm, and in severe cases, electrical cardioversions may be required. Stress and alcohol are the typical top contributors, so it is crucial that you reduce it or slow down from it to prevent this sort of heart-related issue. There you have it, the top holiday injuries and medical issues I see in the emergency department every year. With a little extra caution and self-care, you can enjoy the holiday season without any unexpected trips to the hospital. If you found this video helpful, give it a thumbs up, subscribe, and check out this playlist right here for more health-related tips. Thank you so much for watching, happy holidays, and stay healthy, my friends.